Hello, everyone, and welcome. I'm Dr. Motahare, and in this episode, we are going to talk about cervicitis and vaginitis, two of the most common conditions that bring women to the gynecologic doctors. Let's dive in. We will start with vaginitis. First, consider that vaginitis is an umbrella term for a variety of different conditions, not just a single disease. The vaginal inflammation may lead to classic symptoms like a vaginal discharge, itching, and irritation. The prevalence is very high. The most prevalent form is bacterial vaginosis, that is followed by yeast infection. Approximately 75% of all women will experience at least one time of vaginal yeast infection in their lifetime. And the third one is Trichomoniasis infection. Maybe this infection is not prevalent in some populations, but still it's the most common non-viral sexually transmitted disease worldwide. And it infects millions of people annually. This slide is the core to our clinical diagnosis. The discharge characteristics are our first clues. Notice the key differences. In bacterial vaginosis, the discharge is thin, homogeneous, grayish-white with fishy bad odor, especially after intercourse with minimal to no inflammation. But in candidiasis or yeast infection, the discharge is thick and curd-like, with intense vulvar and vaginal itching, burning, and redness. Trichomonas infection leads to profuse, frothy yellow-green discharge with a strong bad odor. Can cause vulvovaginal irritation and also dysuria. That means the pain or irritation when you urinate. A strawberry cervix, which is punctate hemorrhage on the cervix when doctors do the physical exam, may also be observed. It's also important to notice that not all vaginitis are because of infection disease. Some of them are because of other etiologies, like what? Like chemical irritants, the soap that you use, douches, allergens which are present in condoms or spermicides, hormonal changes, atrophic vaginitis in postmenopausal women or after childbirth can lead to vaginal dryness and also vaginitis. Symptoms typically is burning, soreness, and discharge. Maybe the same, but the etiology is different. Moving to cervicitis, which is the inflammation of uterine cervix. Unlike vaginitis, which is almost always symptomatic, cervicitis is frequently asymptomatic. The primary cause of infectious cervicitis are sexually transmitted disease. Chlamydia and gonorrhea are the two big reasons that we should consider. We should also think about other possible infections like Trichomonas infections and Mycoplasma genitalium. Sometimes cervicitis is not infectious. It's because of some kind of allergic reaction, for example, to spermicides, or because of douches, or because of latex condoms, or from a reaction to a foreign body like cervical caps. So, like vaginitis, cervicitis also is infectious and non-infectious. When the symptoms of cervicitis do appear, they are often non-specific. The most common symptoms is one, vaginal discharge, and second, postcoital bleeding, which is bleeding after sex. So, when we should seek for medical care? Any new, unusual, persistent vaginal discharge, vaginal itching, burning, or discomfort, bleeding between periods or after sex. It's very important. Bleeding after sex is very important. There are other differential diagnoses too. That's why if you have bleeding after sex, you should seek medical care. Even a spotting, not a big amount of bleeding. If you have painful sex or you have pain when you urinate, you should seek medical care too. Prompt medical diagnosis and treatment is essential to prevent serious complications like pelvic inflammatory disease, which can lead to infertility, ectopic pregnancy, and chronic pelvic pain. Diagnosis starts with a complete history. We will ask about symptoms, about sexual activity, and also hygiene habits. During speculum examination, we are not just looking for discharge. We will look for the cervix shape, redness, friability, which is easily bleeding with any contact, and also any discoloration areas. Then we will go to bimanual examination to look for cervical motion tenderness, which is a very, very important sign for pelvic inflammatory disease, PID. This is the gynecological exam that should be followed with other lab and also other complementary steps. While physical exam gives us good clues, we should do some lab tests to confirm our diagnosis. There are some point of care tests that can easily be done in the office of your gynecologist. One of them is vaginal pH, which is different in bacterial vaginosis and also candidiasis. Or another test is a whiff test, which is adding potassium hydroxide to vaginal secretion and looking for fish odor, which is very specific for bacterial vaginosis. The other test is just simple microscopy, just adding a little normal saline to vaginal discharge and looking under the microscope, looking for neutrophils which are covered with bacteria, which is specific for vaginal bacterial vaginosis. The other test is adding a little KOH, potassium hydroxide, to vaginal secretion, and then look under the microscope to see the candidiasis, the hypha of the fungus. All of these point of care tests are easily available and easily can be done in everywhere, and they are very good clues to very good guides to just confirm our diagnosis. The gold standard for diagnosis of infectious cervicitis and Trichomoniasis infection is nucleic acid amplification test, NAAT. In this test, the DNA of different pathogens are amplified and then give us the diagnosis. It's very sensitive and specific. We can use both vaginal swab or urine sample. Urine sample is more comfortable for the patients, but it should be first morning urine sample. The treatment is guided by the diagnosis. There are very simple treatments for bacterial vaginosis, candidiasis, and Trichomoniasis infection. But it should be considered that For bacterial vaginosis and candidiasis, we don't need to treat the partners, just the patient. But for trichomonas infection, we should treat the patient and all partners in order to avoid ping-pong reinfections. So for bacterial vaginosis and yeast infection, it is not needed to treat the partner. But for trichomonas, it's completely needed. Prevent reinfection. Treatment of cervicitis is very important because untreated cervicitis can lead to serious complications. The current guidelines recommend empiric treatment for chlamydia and gonorrhea at the time that we just suspect the presence of cervicitis by these two organisms, especially for very high-risk patients or when you are highly suspected to this two infection, and also when you think that maybe the patient will not come again. So the start the empiric therapy means that you just cover bacteria at the same time, and then when the result of our lab, like nucleic acid amplification test is ready, we can shift to specific therapy just for that organism. The important point here is that both patients and all partners should be treated, and they should avoid sex at least 7 days after initiation of treatment, or avoid sex until the duration of treatment is completed and also all symptoms are resolved. Because if they don't follow this instruction, they will get the infection again. And continuous infection with these organisms can lead to severe problems like pelvic inflammatory disease, infertility, ectopic pregnancy, and also chronic pelvic pain. So we start antibiotic therapy at the time that we are suspecting to cervicitis, and then after we have lab results, we can shift to specific therapy. Prevention is just as important as treatment. This is where patient counseling comes in. We should discuss the importance of consistent condom use. Why? Because this is the most important way to prevent sexually transmitted disease. We also advise against douching, perfume sprays, or very powerful soaps in the genital area. Because all of these things can change the normal flora of the vagina and give opportunity to pathogens to overgrow. We also encourage people to wear loose-fitting, breathable fabrics like cotton underwears to prevent a warm, moisture area to promote yeast and bacteria overgrowth. And of course, it's also important to reinforce the importance of regular checkups. Thank you all for your time and attention. I hope this presentation was helpful for you. Stay healthy, stay